Okay. Now tell me about your symptoms, your pain before the surgery.
Well, I had considerable pain, especially down the left leg, a sciatic nerve issue,
Yeah.
which followed actually total knee replacement.
Yeah.
It never went away.
So 1 to 10, how bad was the pain? And how long did you have it? Yeah, I see your eyes are rolling.
I
So
would
it was
say-
bad, huh?
Yeah, it was bad.
Yeah.
It was like 5 or 6 months of
Mhm.
just basically
8, 9.
enduring the pain.
Yeah.
Yeah.
How bad 1 to 10 would you say the pain was when it was bad?
It was bad, at
Okay.
least 8.
8. Now, you have you had a scoliosis,
Yes.
and your surgery was a minimal invasive olive procedure that we did about a month ago. Is that right?
Yeah, August 5th.
Yeah. So now it's September 2nd, so it was about a month ago, not even a month ago. And in your surgery, we did correct your scoliosis. And your spine is more or less going straight up and down here. And here we see that the screws are all in the perfect position. Here the screws are exactly the same size as the structure they're going through, and they're all perfect. And if you look at your spine going up and down here, it's not side bending anymore. So your scoliosis is gone. Do you remember the surgery still?
Yes.
So okay, how are you now?
I'm definitely improved. I
Mhm.
still have some pain, naturally.
Yeah.
And I'm managing that. My walking is a little floppy.
Yeah.
And I'm
Yeah.
assuming that in time that gets better.
And it does. But you told me that your pain is somewhat worse because you had to drive a long way.
Yes.
So tell me, why did you have to drive a long way to get to me? And why didn't you go to a local surgeon?
Because there was no one that was doing this minimally invasive surgery. And also being one of Jehovah's Witnesses, I would not accept any blood transfusion. So that was another factor that appealed to me to come here, even though
Yeah.
it has its inconveniences because
Yeah.
of the distance.
Yeah, and this is exactly the point, that in an open old-fashioned surgery, it is normal. Is nothing wrong with what the other surgeon told you, multiple of them you told me, that you would lose so much blood in a surgery like that you couldn't survive without blood transfusion. So practically you had a choice between your faith and your pain, your health, your life. And I think that is what we did by reducing the blood loss of this big surgery, 5-level fusion, to half a cup of coffee. You didn't have to make that choice anymore. And I think that is an important fact that now in your case, it is definitely, it was extremely important, but as well in many other people, not only we reduce the blood loss, but as well we reduce all the risk associated with the surgery. So many people, they cannot get the surgery because they are elderly or because they have other medical problems, and all of them qualify for our surgery because our risks are so much less.
Yes.
Now, the pain that you said before the surgery was up to 8, was it in the legs? The leg pain?
Yeah, the sciatic nerve coming out of the
Yeah.
whichever joints of the
Yeah.
lumbar.
How is that pain now?
It is essentially gone.
Okay, you see that is the best prognosticator that says that the surgery worked and now we are just dealing with the healing process.
Well, the blood loss thing is a major one. You're more
Yeah.
careful a surgeon is when you have that factor to work with.
Yeah.
And we've heard this before. And so because of our faith and other factors, why we just thought this was the best choice by far.
Yeah.
I'd
yeah.
recommend this one. If I was going to have it, I'd go this route myself.
Yeah, and we see that one of the reasons in the open old-fashioned surgery we lose a lot of blood is, I'm going to describe it to you if you don't mind to hold it for me. In the open old-fashioned surgery, we cut the skin all the way down and then we separate the muscle, we literally fillet it open.
Right.
And these are live muscles. Then they start bleeding. Then we use actually electricity to cook the tissue.
Yeah.
And then we
Alright.
cut the bone a lot, and bone, when you cut it, bleeds a lot.
Yeah.
And then once we get to the bottom here, there's a spinal cord here, and there are lots of veins around that. When we open them up, and they bleed a lot. So that is not unusual for a surgery, 5-level fusion like that, to lose almost 1/2 or to 2/3 of your blood, and we will replace it. Usually, it's still dangerous, but we'll replace it. But our surgery bypassed all of that, and we went at an angle, bypassed all the muscle. We didn't have to cut it, cook it, stop the bleeding. So that is why we lost only 110 cc of blood, half a coffee. And that's not only in your situation, but in the situation where lots of people have like heart problem.
Right.
It's a big deal for
Yeah,
them.
exactly.
Well, overall, so far happy with the results, even though you have to drive this long to come to see us.
Yes,
Well,
yes, I'm happy with the
Well,
result.
thank you so much. I
It's worth
appreciate
it.
it. Thank